Okay, Ms. Barker, I'm going to examine your abdomen right now. You let me know if anything hurts, okay? The first thing I'm going to do is I'm just going to look, okay? And what I'm looking for is any scar, anything along those lines, any distension of your abdomen, if there's any asymmetry, and I don't see any at all, okay? The next thing I'm going to do is listen. Warm this up a little bit. Not too cold?
It's okay.
Okay. And I'm going to initially listen in your left upper quadrant away from the area of pain. Listening for your bowel sounds, which seem normal. That hurt you a little bit?
Yeah.
And I can tell when I push just a little bit with
Yeah.
the stethoscope that that's an area of tenderness, so I'm going to avoid that area. Now, I get my stethoscope in, I'm going to push gently on your abdomen. Are my hands cold?
No, they're fine.
Okay. I'm first just going to press lightly, and again, you let me know if anything hurts. Okay, that hurts.
hurts.
Okay, I'm sorry about that. I'm going to press a little bit more deeply. I'm not going to touch this area again, however. You just let me know again. That hurt at all? Okay. Oh, where did that hurt? That hurt where I pressed?
No, in the same spot it's been hurting.
Okay. That's actually called Rovsing side. When I push on the left side and it hurts on the right, that might indicate that you have appendicitis. The next thing I'm going to do is feel your liver. I'm first going to feel for the edge of the liver, and I don't feel it, and that's normal. That indicates that you do not have an enlarged liver. I'm now percussing to see whether or not the liver edge is in fact here, which it is. And then I'm going to feel for your spleen around this side. Okay. I'm going to have you roll just a little bit towards me. Your spleen does not feel enlarged. I do not feel the border of it, which is a good thing. Okay. Roll back down here. The next thing I'm going to do is something called an obturator sign. I'm going to take your leg, your right leg, bend it at the knee, and I'm going to move it in. And I'm going to rotate. Does that hurt?
That hurts.
Yeah.
Yeah.
Okay, so that's called a positive obturator sign. And again, that indicates that you might have an inflammatory process such as appendicitis or diverticulitis on this side. Okay, I'm going to do another test, again to assess that, called a psoas sign. So if you could roll away from me. Take your time, let me help you here. Good. And again, I'm going to take your leg, your right leg, and I'm going to pull it back. Okay, that hurts?
Yeah, that hurts.
Okay. And that's, again, that's a positive psoas sign. And if you could just stay there, I'm going to do a rectal exam. Some of the things that I'm going to be looking for are pain on the exam, pain that would be very much the same as your pain that you're having right now, or any masses, anything along those lines. To make this a little bit more comfortable, I'm going to ask you to bear down on my finger. Take a deep breath in, bear down, and now relax, okay? Is that hurting you at all?
No, it's uncomfortable, but
Okay. It's not bringing back that same pain?
no.
Okay. Okay, and there's no blood in your stool, and that's a good sign. Okay, you can roll back down onto your back. Okay. I'm now going to do a gynecological exam. What I'm going to be feeling for is your cervix and your ovaries, again to assess if there's any infection of those organs. So if you can slide down, I'm going to have you put your feet in the stirrups here, right there. Here, hold on to me. There you go.
That hurts too much.
Oh, I'm sorry. Yeah, that's a sign. I'm worried that you might have, in fact, appendicitis or something like that. Okay. Okay. Yeah, you feel my fingers in there? Sorry if it's a bit uncomfortable. I'm moving your cervix up and down now. Does that hurt you at all? Okay, good. I'm now going to feel here for your ovary. Does that hurt?
No.
Not the pain? Okay, just uncomfortable?
Yeah.
Okay, good. And I don't feel any inflammation or inflammatory process there. Okay. Okay, so we're going to run a series of tests on you now, some blood work, get a CAT scan, then I'm going to let you know what I think is going on. Okay? All right.